Hello and welcome back to our channel with a new video. Today we will discuss all you need to know about shoulder pain. Let's start with today's video. Daily tasks like brushing or drying your hair, reaching behind your back to secure a bra, or grasping something overhead might all seem like enormous tasks when you're suffering from shoulder pain. As you become older, you're more prone to getting shoulder pain due to a variety of reasons. The pain might start slowly or suddenly, and it can range from minor to intense. Let's talk about shoulder pain causes, treatment options, and prevention. There is a big list of causes for shoulder pain. Few of these causes are not originating from the shoulder joint itself, known as referred pain. The causes of shoulder pain might differ from one person to another according to gender, age, lifestyle, occupation, and general medical condition. Before we discuss this list, we would like to enumerate a few facts about the shoulder joint. 1. It is made up of a joint between the humerus head and the glenoid, part of the scapula. 2. It has the greatest range of motion of any bodily joint. 3. It is the joint that is most frequently displaced, with anterior dislocation being the most common. What causes shoulder pain? 1. Shoulder arthritis. Shoulder arthritis is one of the most common types of arthritis. A common source of shoulder pain, especially in the elderly. Although age is merely a number, arthritis becomes a common source of joint discomfort by the age of 50 to 60. Shoulder, hip, knee, etc. Arthritis can be idiopathic, meaning without a known cause, or secondary, meaning caused by a systemic disease or a previous injury. Unless the arthritis is severe, which causes persistent pain, arthritis pain normally increases with activity and reduces with rest. 2. Rotator cuff diseases. Pathology of the rotator cuff is frequent in both young and elderly people. Impingement, inflammation, partial or complete tear are examples of these pathologies. As the muscles impinge on the bony structures, impingement or minor tears cause pain at the extreme range of motion. In large tears, the pain may be continuous and be coupled with a significant reduction in range of motion, as well as nocturnal pain. 3. The long head of the biceps muscle. There are two heads to the biceps muscle, long and short. The long head is interarticular, which means that it passes through the joint. This long head can become irritated or even torn, resulting in anterior shoulder or upper arm pain. The anterior portion of the shoulder, just distal to the joint, is frequently the site of pain, the upper arm. 4. Labral injuries. The soft tissue lining around the glenoid is known as the labrum. It increases the depth of the glenoid, which helps to provide stability. Acute and chronic labral injuries are both possible. Deep shoulder pain with a limited range of motion can be caused by chronic injuries, also known as degenerative. Acute injuries are more common in younger individuals, and this could be as a result of a single traumatic event or a continuous repetitive strain on the joint. Acute labral injury is characterized by deep joint pain that may be accompanied by clicking, particularly in younger patients, or by a feeling of instability in situations of dislocation. In this case, it might be a painless sensation of instability with an almost full range of motion. The pain is minimal and similar to arthritic discomfort in elderly patients with chronic degenerative labral injuries. 5. Acromioclavicular joint arthritis. The acromioclavicular joint, located anteriorly and on top of the major shoulder joint, is a tiny joint with very limited motion. The clavicle articulates with the acromion, a portion of the scapula/shoulder blade, collarbone. This joint may become arthritic, space narrowing, creating pain that is well localized anteriorly, but is experienced as shoulder ache. If it happens alone, it is usually not associated with a limited range of motion or nocturnal pain. 6. Nerve pain. The axillary, suprascapular, and infrascapular nerves all go around the shoulder. Any of these nerves around the shoulder that are impinged will usually produce sharp shooting pain. 7. Brachial plexus injury. The brachial plexus is the bundle of nerve trunks and cords arising from the neck and feeding the whole upper extremity down to the fingertips. Shoulder discomfort could be caused by injuries to the brachial plexus as a result of systemic disorders or trauma. It usually presents with sharp shooting pain in the arm or forearm or wrist and hand, and could be associated with weakening in the muscles involved and diminished feeling in the afflicted dermatomes. 8. Neck pain. Because the illness does not originate from the shoulder joint, it is also known as referred pain. This is a common cause of discomfort that might be mistaken for shoulder pain, despite the fact that the shoulder is not diseased but experiences the pain. Neck pain can be caused by degenerative disc disease, spinal stenosis, foraminal stenosis, the foramen where the nerve root exits the spinal cord, or paraspinal muscular spasm. Numbness, tingling, and maybe weakness down to the hand might accompany this pain, which is unusual in real shoulder pain when the illness originates from the joint. 9. Infection. Without predisposing circumstances such as shoulder surgery, open fracture, or underlying immunosuppressive disease, this is unusual, but it can happen on its own. This might manifest as cellulitis, a superficial infection, or a deep shoulder joint infection. It's frequently accompanied by redness, swelling, a reduction in shoulder range of motion, and fever. This type of pain is characterized by constant excruciating pain, even when at rest, as well as skin redness, swelling, and systemic alterations such as fever and chills. 10. Inflammation. For example, bursitis, which is different from the infection since there is no pathogen. It is inflammation of the tissue around the shoulder joint, usually involving a bursa, which is a natural sac of fluid, or the inflammation could be in the rotator cuff muscles known as tendinopathy. This usually presents with decreased range of motion and pain. 11. Frozen shoulder, also known as stiff shoulder. It can arise with no apparent reason, but it is more common in females, diabetics, breast cancer therapy, cardiovascular illnesses, myocardial dysfunction, thyroid dysfunction, sedentary lifestyles, or prolonged shoulder immobilization for whatever reason. External rotation deficit is the most common cause of a decreased range of motion, and discomfort increases as the range of motion decreases. The passive range of motion will be limited as well. 12. Scapular pain. This can be caused by a variety of factors, such as trauma or dyskinesia, which is altered scapular position and motion. Kyphosis, clavicular fracture malunion or non-union, or scapular winging can all cause dyskinesia. Usually, there is either history of trauma or deformity on physical examination. 13. Trauma. Fractures such as proximal humerus fracture, scapular fracture, acromioclavicular joint separation, etc., dislocations, and soft tissue injuries are all possible outcomes. Shoulder pain could result if any of these conditions were overlooked or mistreated. If you have a history of trauma, such as a fall or an accident, you should consult a doctor. That is, don't neglect your first injury. We occasionally see injuries weeks or months after the first incident, which can result in inferior outcomes. 14. Muscular. Over time, the muscles surrounding the shoulder can get fatigued. This could be related to aging or persistently bad posture. Upper cross syndrome is a prevalent condition in this group, in which the muscles of the neck, upper back, shoulder, or chest become distorted and adopt non-anatomic postures, resulting in a change in dynamics and eventually chronic pain. This frequently happens to those who sit in specific positions for long periods of time, such as sitting at a desk incorrectly for a long time, riding, or driving for prolonged periods. 15. Systemic disease. Inflammatory arthritis, fibromyalgia, multiple sclerosis, and other disorders can cause joint pain, the list goes on. Even cardiac problems, such as a heart attack, can cause pain in the left shoulder. What are the treatment options for shoulder pain? The type of treatment will be determined by the cause and severity of the shoulder pathology. Over-the-counter medications, prescription oral or topical medications, Modalities such as local ice or heat, physical therapy, shoulder-localized injections, or surgery are the main treatment options. The most commonly prescribed medications are acetaminophen, non-steroidal anti-inflammatory pills, ibuprofen cream, or certain nerve pain medications if there are nerve impingement symptoms. Modalities such as icing the shoulder for 15 to 20 minutes 3 or 4 times a day can help minimize your pain. Because putting ice directly on your skin can cause frostbite and burns, use an ice bag or wrap the ice in a towel. Unless there is a fracture, you should avoid immobilizing your shoulder. A very common mistake is using a shoulder sling for an extended period. This would lead to a frozen shoulder and add to the original pathology. Physical therapy, either formal sessions by a physiotherapist or informal exercises at home, are always indicated in most cases. Remember, as long as you do not have a broken bone, you should keep mobilizing your shoulder even if you have some pain. In certain situations, we always tell our patients, no pain, no gain. Shoulder injections can be either corticosteroids or platelet-rich plasma. Each has its advantages, disadvantages, and indications. Your doctor can explore this with you. Shoulder surgery can be either arthroscopic with only a few poke holes incisions, or a formal open procedure. Regardless of the procedure, there is always a post-operative recovery period from weeks to months. In conclusion, as previously stated, shoulder pain can be caused by a wide range of factors. The key to a successful diagnosis is taking a thorough medical history, understanding the underlying medical issues, and scheduling the necessary tests. Our advice is to get medical help as soon as possible. Still, need more information on this topic? Please check out the links in the description box below to learn more about our resources and other helpful materials. Before you go anywhere, make sure to give our video a thumbs up and also subscribe to our channel and click on the bell symbol so you don't miss any of our intriguing videos. Stay tuned until next week.